We, the cancer organizations here represented, call on the government and non-governmental players to make radical and bold decisions in the following areas. Acknowledge that access to effective, quality, and affordable integrated non-communicable diseases program at every level of government is a right of every Kenyan. Urgently engage the private sector through private-public partnerships to explore how the available cancer resources can be accessed by all Kenyans. This should involve not just the private hospitals who have invested heavily in cancer infrastructure, but also the pharmaceutical companies and the entire diagnostic and treatment technology industry. Thirdly, is to end to fragmented screening. All players involved in any form of screening should be obliged to integrate essential screening of all non-communicable diseases in their programs. Blood pressure, blood sugar, body mass index, and cholesterol are cheap modalities that all should be available to all Kenyans. Fourthly, is to declare cancer and other non-communicable diseases a national disaster and place them at the heart of Vision 2030 Health Development Framework. Fifth, Parliament to urgently amend the Customs and Excise Act to provide for exceptions in the Railway Development Levy so as to ensure a permanent solution for all cancer and healthcare-related donations. Sixth, the government through the National Environmental Management Agency and related agencies should take stronger measures to protect the public from pollution-related diseases. And seventh, given that all the cutting-edge cancer technology is located in Nairobi and within a 5-kilometer radius of each other, government should put a moratorium to development of additional cancer infrastructure in the city. And indeed, the government should seek to promote devolution of cancer treatment services to other parts of the country. And eighth is to regulate advertising by herbal practitioners and faith healers to deter unsubstantiated claims of healing of chronic and non-communicable diseases, a situation that takes advantage of the desperation associated with chronic diseases. And the ninth is to make non-communicable diseases central to all health strategic plans for the counties and allocate funds to address this critical public health problem. And 10th is to develop guidelines and adequate information with cancer counseling of patients seeking treatment in India and other countries to enable patients and families make informed decisions when diseases is advanced and traveling abroad may not confer any benefits. And 11th is to call on private hospitals to work on a deliberate strategy to tame the tide of patients seeking treatment when they can be able to get assistance from local facilities. And of course, I think more importantly really is to operationalize the National Cancer Control and Prevention Act, which even though it was passed in 2012, is yet indeed to see the light of day from the Ministry of Health.